kinds of models that we're looking for, as well as the models that I talked about with Instituto and with the National Latino Education Institute. Thank you.
Excellent, and I appreciate and I should make a mention, of course, as a protocol respect, that yes, as we now move into a new administration on a state level, we now have Governor-elect Rauner, and of course, I look forward to being at that table. As I've always said, we will no longer be on the menu. But just looking around you and seeing the leadership in this room, that you are the network. And it's amazing because we can refer to you as first name to show the longevity you all have and the important role you play as you walk as individuals, but when you come together, think about who's in this room. With that said and done, we're going to move right along to Elba Aranda Shu, and welcome.
Good morning, everybody. Thank you so much, Senator Delgado. I really appreciate your leadership and everything that you've done for our community. And to our my fellow panelists, you are, wonderful leaders, and so I'm humbled, to be sharing a panel with you.
Likewise, believe me.
And kudos back to you, Julio, for all the work that you do in the state of Illinois. Unfortunately, NLA doesn't receive as much money from the state of Illinois, but that's another discussion with regards to economic development, and a lot of people do not realize, I think, the enormous opportunity that the Illinois Department of Commerce and Economic Opportunity has, and has the potential to do specifically for the Latino community. But that all goes back to policy at the greater level, at the national level. So it's not just an Illinois thing, but it's a national thing. Just a little bit about myself. Well, first of all, I work for National Latino Education Institute. I'm the organization's executive director. I've been in that role for 5 years, succeeded Mary Gonzalez Koenig, the founder of the Spanish Coalition for Jobs. So many of you may know NLEI as the Spanish Coalition for Jobs, founded in the mid-1960s. So the organization was founded and birthed with industry at the table. Early on, the organization and its founders and the people that organized were taking a look at better opportunities for Latinos in jobs. And so those are our roots, and we were birthed there. And so we've been working with employers from the very, very beginning. A little bit about myself. I've been in the world of job training for over 20 years. Can't believe that. So I've seen various legislation as well. The end of CETA, hardcore JTPA, the introduction of what was WIA, and then the reauthorization but not updating of the YIOA, whatever, the new legislation, which was reauthorized but not really updated to, I think, a lot of the climate that we're trying to work with in terms of getting access to training and getting our people better prepared. A couple of other things. In addition to NLEI, some things that might be a little relevant to this panel is I'm also on the Illinois Latino Family Commission and the chair of the Economic Development Committee. And so some of the things that we are looking at is better opportunities for Latinos in industries such as healthcare. And how are we going to be able to help Latinos access the existing jobs? Because as you know, the state of Illinois is the second largest employer in the state of Illinois. So there are a lot of jobs that are available. And so we need to make sure that our community has access to them. And so to that end, I do invite you to a workshop we're having, the commission together with NLEI on December 11th, to specifically learn about the various job opportunities within the state of Illinois. And these are jobs that are not necessarily going to be affected by the new administration, FYI. Another thing is I'm also on the Illinois Workforce Healthcare Task Force that took a look at healthcare employers what their needs are, and what the state of Illinois is doing in a very broad level. I'm happy to report that even before the report came out is that NLEI is offering training and educational programs in 4 of the occupations that the state identified are the top occupations in great demand and that desperately need bilingual talent. So I'm going to talk a little bit about NLEI and then kind of move into some of the kind of issues I think that we need to take a look at and maybe perhaps providing some humble recommendations. National Latino Education Institute changed its name to NLEI because even though we were known as Spanish Coalition for Jobs, the important thing has always been from the very beginning, education. So we took a very purposeful look at ensuring that education was always going to be as part of the name, because it is truly the economic tool in order to really combat poverty. Our focus has and continues to be to focusing on the capacity and the skills and the potential of the leaders of the family. And the leaders of the family can be a single parent, a young adult, a mature worker, etc. And so we look at a very holistic approach in how to make sure that the head of the family has all of the tools necessary to break that cycle, to become independent, to have economic freedom, to have a path to higher learning, and to have a path for economic prosperity for themselves and the generations to come after them. But NLEI is a very unique hybrid. So we are a community-based organization. So we do work with programs, funded by the state. We continue to do direct employment services. We do adult education, and we do a variety of job training initiatives. But additionally, we are also a nationally accredited school, and we are also a private business and trade school. So I realized, actually even more recently this week in Washington, that our uniqueness of this organization in Chicago that has these various lenses to be able to look at education, higher education, community-based grassroots, employer lens, adult education, and trades. And I keep realizing the uniqueness of the organization, so I just wanted to explain that we are a community-based organization, but we also have the power to give our students credentials, to give our students certifications, because that's important to be able to compete in all industries, not just healthcare. But equally to that, we want to make sure that the quality of care is there. So I tell my students all the time, because one of the things that we offer is phlebotomy. Phlebotomy is offered as part of a comprehensive training program, but it's also offered as its own profession. So many times I tell the students, and we train it at NLEI. We are accredited by multiple accrediting institutions, including KHEP, which is a very specialized healthcare accreditation. So we have the ability to offer them this credential, this post-secondary credential. But for example, in terms of making sure that the quality of care is there is so important, and a lot of people do not realize how public health, quality of care, and workforce development is all connected. Because if we don't have the personnel that is able to provide culturally sensitive and high-quality clinical care, then what are we producing? So it goes hand in hand. So I started talking about the students, the phlebotomy students. I say, I want to be able to bring my mom, my kids, because you start marking me up, And so we also teach how to be a patient advocate. So it's a very holistic approach. I'm very proud to say that our students rank above standards in their not only their educational attainment, and their competency levels and clinical skills. So they have very low risk in their phlebotomy and all their clinical procedures. And I'm going to quickly do a shout out to a fellow panelist here, because she's been my employer. She's employed many of our graduates. She's mentored many of our graduates. She's also a leader in healthcare as a profession. Because of all of the industries, one of the things that the organization does is fight for Latinos at different levels of talent. You know, from entry level to middle to upper to governance, right, to decision makers at the top. Because that's part of the equation in terms of the talent pipeline. And healthcare is not immune to that. In fact, when you look at Latinos and leaders of industry, healthcare is the one where Latinos are the least. Susana is a leader in that industry. So I had to, and I've been working with Susana for a long time. So she knows, first and foremost, the importance of quality of care, because she's a practitioner. She's been an employer. She's been a mentor, and she's been a leader in her industry. So we have, she has her own success stories with some of my success stories, of the people that we have served and trained. And so it truly takes a village to do that. And there are graduates in the audience of NLEI, so I'm happy to see. And we have another employer partner of NLEI in the audience. So we have several. And of course, Alivio Medical Center has also been a very important ally, also in all the different areas that Susana is as well. But it does take a village to do this. We cannot look at healthcare training or the world of training for healthcare careers in silos. It's all, it's all connected. So I wanted to touch on that. Some non-healthcare offerings that NLEI offers is business development, construction and pre-apprenticeship, technology, entrepreneurship, consumer education, and also job placement continues at all levels, including executive. I'm going to briefly go into some of our healthcare offerings. We do certified nursing assistant, medical office specialist, insurance and coding, phlebotomy, CPR training and certification, medical office assistant, pharmacy technician, EKG technician, and we're also a national center for certification called the NCCT Testing Center. But we also do preventative healthcare education, because again, it's all related. Quality of care is directly related, but also being a healthy worker is also part of the component. So preventative care education is equally important. So we battle, I shouldn't say battle, we address cancer, lung disease, diabetes, nutrition. And it's funny because a lot of the non-healthcare training students say, well, why don't we need to learn this? Why is this part of NLEI's curriculum? Why is this part of NLEI's, why are we mandated to learn this? And same thing with consumer education. And if you take a look at costs from an employer perspective and from an employee perspective, we're doing our job to ensure that you have access to training. So part of that job is ensuring that you're a smart consumer, so financial literacy is part of it, that you are also smart in wellness, because that's all going to be part of the whole smart worker package. In terms of some of the trends that we see in the arena of healthcare education, I just want to share a couple of statistics. According to the Bureau of Labor, Hispanics make up more than 1 in 7 Americans, 15.4% in healthcare in terms of employment. But they account for only 1 in 17 in healthcare professionals. But yet we hear the statistics about the enormous opportunity